All right. Good afternoon, everyone. Today is December 17th, Friday. This is our Bariatric Friday. I believe we are the most dynamic bariatric program in the country, as we are here every week. Today, I have Dr. Irgau, who's going to be part of the session. Dr. Irgau, how are you doing?
Very well, Kemal. How are you? It's nice to be back on Bariatric Friday.
Thank you for coming back. So we are going to discuss another topic today. And before we do that, I do want to do the introduction for our other surgeons and program providers. So as everyone knows, Dr. Irgau, who's the regular for this session. And we have Dr. Gail Wynn. She is the most experienced female surgeons in the country and in bariatric especially. Dr. Michael Peters, and then Dr. Rose Singh. And finally, we have Dr. George Ibrahim on the bariatric side, and Dr. Sachin Babe as our colorectal surgeon. He's part of the team. So the program also have dietitians and our registered dietitians who are part of the team that we are actually managing these patients, our patients with the multidiscipline approach, and Fran and Bat and Amy, and finally another Amy Scott, who are part of the program. And all four are very familiar with the bariatric patients with morbid obesity, and before and after. So it's not just prior to surgery, even for the after, we are working with our patients together. So from our different topics that we discuss, you can always catch us on our YouTube channel. We are posting these after the events. And today we are going to discuss intermittent fasting. And before we start, Dr. Irgau, if you can just give us the background on the qualification of the bariatric surgery, and then we can start with the topic.
Absolutely. Thank you, Kemal. So the mainstay of our specialty is weight loss surgery or bariatric surgery. And bariatric surgery currently is the most effective treatment we have for morbid obesity. Morbid obesity is defined as extreme obesity, where the weight has gone really to an extreme extent. And for definition purposes, we talk about a weight which is about 100 pounds over the person's healthy or ideal body weight. So if a person who is about 5'5" in height is supposed to be around 150 pounds in weight, if they in fact gain weight and now their weight is 250 pounds, that would be the definition of morbid obesity. Another way to look at this is to quantify something called BMI or body mass index, which is a number that we calculate by putting the height and the weight of the person together. And morbid obesity is defined when the body mass index reaches 40 or above. Sometimes, however, even a body mass index as low as 35 can qualify a person for bariatric surgery if that person has already developed some of the serious health consequences of obesity, like type 2 diabetes, high blood pressure, or sleep apnea.
And any cardiac disease, right, Dr.?
Absolutely, cardiovascular diseases.
All right. Thank you, Dr. Erkan. So we are going to discuss intermittent fasting. So Dr. Guy, you introduced this diet.
Absolutely. So there are obviously
what I would say is that you introduced this to me like last year, right?
Yes.
Now, there are easy days, there are more difficult days, easier weeks, more difficult weeks. Holiday season is always problematic. Now, if we can just better understand what intermittent fasting is, and who can do it, who should do it, and what the benefits are. So we are going to discuss those.
Absolutely. So intermittent fasting essentially is a very simple way for people to restrict their calorie intake. But it's not only that, Kemal. It's not just about how much you can reduce your calorie intake. It's actually about optimizing your hormonal situation so that your metabolism helps you to lose weight. That's really the bottom line. In fact, what we know now is that every time we eat any type of calorie, whether it's 1 calorie or 100 calories, whether it's something that is drinkable or something that is edible, our digestive system doesn't simply break down the calories and then introduce them to our body. Our digestive system actually starts a cascade of messengers that circulate in our body, and they have specific functions. One of those messengers is a hormone known as insulin. And people may be familiar with insulin because it is related to the treatment of diabetes. In fact, insulin is a hormone that we all have in our body, right? And what insulin does is that its level is elicited by how much calorie we intake. So if we intake some calorie, the insulin level will go up in our blood, right? So the notion that most people may understand is that insulin will help us to lower down the glucose level in our blood. But insulin does something else also, something very, very important, and that it regulates the passage of fat in and out of the fat cells as well. So if the insulin level goes up, the fat cells are encouraged to hold on to the fat inside. If the insulin level remains flat, fat cells are encouraged to release fat for use in metabolism, right? So every time we're eating, what we're doing is we're introducing really a message that says to our fat cells, hey, hold on to the fat, don't utilize it. So every time we eat, not only we're adding calories, but also we're giving message to our body that holding on to the weight is the right thing, right? We are unable to lose the weight. We are unable to metabolize the fat, okay? So which means that every time we are eating on a continuous basis in our waking hours, we are actually encouraging our body to hold on to the fat. So if we have a period of abstinence from calories, right? Like we do, for instance, when we are asleep, we all have a period of fasting in our 24 hours because when we sleep, we don't eat, right? The only thing that enters our mouth is air at that time. At that time, actually, the insulin level is fairly flat, and our fat cells are actually encouraged to release the fat that can be utilized for our metabolism. So the idea of intermittent fasting, Kemal, is to expand this period of abstinence from calories throughout our waking days. And most people will say, well, I do that all the time. I eat only once a day. I don't eat, and yet I still gain weight. Well, but actually, people who say that do not realize that through the day, by munching on one or another thing that has calories, they're actually continuously eating. They are continuously stimulating their insulin level, right? So for this to work, the abstinence from calorie has to be absolute during the times of fasting. So we can organize intermittent fasting by thinking about our 24 hours in terms of a period of hours in which we are totally abstinent from calories, we're fasting, right? And then a window of hours in which we allow ourselves to eat. So for instance, if a person stops eating any type of calories at 8 p.m. at night, but then they go on without introducing any calories until, let's say, 12 p.m. the next day, right? So that they don't have breakfast, they don't have any snacks. Of course, they're having water, they can have coffee without sugar, they can have tea without sugar again. So all drinks without any calories, but then they have their first meal at 12 noon. Now, automatically, that person will have fasted for 16 hours. Well, if you fast for 16 hours, because there is only 24 hours in a day, it means you have only 8 hours left for you to eat. Your eating would be 8 hours. So we talk about a 16-8 regimen. We talk about a 18-6 regimen, meaning 18 hours of fasting and then for 6 hours of eating.
So, Dr. Irgau, the way that intermittent diet fasting started, it wasn't for weight loss. So it was actually for aging.
Absolutely. Absolutely.
The way of stopping the aging in a way. And what you explained and we discussed this so many times in our one-on-one meetings as well. The idea of what our body does every time we eat or we drink something. Now, for example, so you come to your office, you have this, right? Now, this is just a cookie, right? So as soon as I eat this, my body is going to do the same thing that if I ate the full dinner.
Yes, absolutely, absolutely.
That's kind of like, now I'm kind of the trophy maker. So there's one for you if you want. So now,
Later.
you have to kind of deal with this. Now there is this guy here. So every time, actually I didn't plan on this, by the way. I just saw them when I was just looking from the level that I'm now. So every time if I just eat the fruit, it's still going to do the same thing. So then it's almost like just starting the machine, this big machine for something very small.
Yes.
So the idea of like running the dishwasher for like 2 plates versus the entire machine, full machine. So it's going to spend the same energy. So that energy actually is the aging that we talk about, right? So as it's happening, then the benefit that they see is there's also weight loss, because this is with the insulin balance, it's actually helping with the whole idea of what we are trying to do with the medication and other stuff. Now, we are the thing is we are a bariatric program, right? So why are we discussing the intermittent diet?
Absolutely. So that brings about an important point. So we are bariatric and metabolic surgeons, right? So we're interested in anything that would change in a beneficial way the metabolism, right, Kemal? So we have patients who actually come to our practice who are seeking bariatric surgery, but they may not qualify for bariatric surgery because their weight is not high enough, their body mass index is not high enough, or their body mass index may be in the 35 range, but they haven't developed any comorbidities yet. And according to the current guidelines that we follow nationally, somebody has to be at a certain weight, a certain BMI for them to qualify for bariatric surgery. Now, we don't just say, well, you don't qualify for bariatric surgery. We are actually giving them guidances as to other options as well. And I personally like intermittent fasting, and that's one thing I actually encourage people to adopt. Not only that, Kemal, clearly we tell our patients that bariatric surgery is a very powerful tool, but it's not a magic answer, right? Which means that it is possible for people to struggle even after they've lost weight with bariatric surgery, whether it's years later or decades later, they can still struggle, right? So when patients come to me saying that they're struggling because they're starting to gain weight, I have to provide them tools also that will enable them to regain the initiative and start really focusing and start losing weight again. One of my favorite one is intermittent fasting. And I think intermittent fasting actually fits very well for post-bariatric patients, particularly, Kemal, because, in their window of eating, they still cannot consume a lot of calories because they have a small stomach. So if we restrict their eating hours, I think we're helping them greatly in restricting the amount of calories they eat. The idea of intermittent fasting comes about because in our society, in our culture, at least modern culture, we have adopted this idea that our digestive system is open for business at all hours, right? Unless we're asleep, we're open for business, which means like the cookies that you're showing on your desk, or anything that may be, in my kitchen desk, or if you go even to the bank, they will have lollipops right there on the desk for you to munch on whilst you're waiting to be served, right? So
one other stuff that Erkan. So sorry. So there's also olive oil.
Absolutely. Absolutely.
That's the key. The food is pleasing, right?
Yeah.
So use it for pleasing. And actually, one of our friends is asking, is it every snack? Like I would like the question.
Yes.
I'm on this diet, right, Dr. Erkan? So, and I came in 1, 2, 3, 4 different items. Now, many of them are in Susan's office. It's a full fight, like full-fledged fight. Me against myself with eat, not eat, and then I'm going to go home. Like later on, Dr. Irgau is going to call and then ask if I did the diet or if I break the diet. Is like this whole stress, right? So, but the society is just pushing the food away. The society is pushing the food towards our way, so that it becomes so difficult to stay on a diet.
Absolutely, absolutely. So it means that, because there is the presence of food is pervasive, it's everywhere and it's all the time. And because we don't have this discipline of saying, okay, my digestive system is closed from this hour to this hour, we don't say that, right? We're open for business all the time. Unless we're asleep, we're open. So if we see something that we like, or if we offer something, either because we like it or because we want to be polite, we go ahead and munch it. So our digestive system doesn't have any closure hours. Well, this is a problem. And this is a problem that can be overcome, for instance, by adopting this lifestyle of intermittent fasting, where you say to yourself, okay, from this hour to this hour, even though I'm awake, even though I'm working, even though I'm going by my daily chores, my digestive system is closed for business. It's not going to have any food at all. It can have water, lots of water. That's a very important component of this diet. But because water goes through our digestive system without eliciting all those hormonal cascades that impair our metabolic health, right? So we can have water or water-like drinks, right? But nothing else. And that's the most important part of it. Now, why do I emphasize water, Kemal, as an important thing? Well, for two reasons. First is that, remember, if we're not eating food, we're also missing that component of water that we get from our food, right? So our body does require a certain amount of water. This is very, very important. We can go on for days or even weeks without eating and survive perfectly well, but we cannot go for very long without drinking water. So water is very important, and we have to proactively drinking it. But there is another reason as well, and you and I talk about this, Kemal, and that is when we are often hungry, we're actually thirsty. It's just we are mistaking the thirst for hunger. Now, because that sensation goes away when we eat, we assume it was hunger, but actually it was thirst. And the reason it's going away is because the food that we eat also does have water that really takes care of the thirst as well. So if we proactively drink, we're not going to be thirsty. We're not going to be mistaking thirst for hunger. So we are less likely to struggle in the hours of our fasting. So proactively drinking a lot of water is very, very important.
So if we can go back to our population, patient population that we deal with day to day, patients that we help, they are not struggling to lose 10, 15, 20 pounds. They are trying to lose 100, 150 pounds. So it's interesting because I do mention this time to time when my friends from different parts of the world, when they know the surgery, the stomach surgery they think that we are just taking the healthy person with BMI 26 and then just making their stomach much smaller, like a nose job. So that's not what we deal with, right? So we deal with minimum of, if you look at the no comorbidity area, that's 40, BMI 40. So now this is my heaviest, one of my heaviest time this last 18 months. And my BMI is still about 27 and a half, maybe. Hopefully I'm not lying. I may be maybe half point. But so we are talking about people who have morbid obesity. Now, utilization of this, Dr. Irgau, my understanding is there are some patients, it's still not not necessarily safest, but it's not most convenient for them and for the surgeon when they are at BMI 62. And we have patients and we have certain things in place, check marks in place, that we do catch those patients early on and work with our surgeons to make sure that, and dietitians, to bring those patients down to 55 and maybe even lower if they're depending on their gender. So that's the tool. Instead of just leaving that to the last 2 weeks, throughout the time, we can actually use the intermittent diet, fasting, and they can actually get to that ideal surgery BMI. Now, the challenge is, if I'm able to do this as a patient, then how is it, why would I not just do it for long term? and then just skip the surgery. Can I do that? Can the patient?
Absolutely. Absolutely. At the end of the day, Kemal, what we want to achieve is a person to get to a healthy weight, right? A person who has a body mass index of 62, Kemal, is a very, very sick person. That person may not know it, but metabolically, that person is a time bomb, right? They are very sick. That weight is a burden not only to their daily quality of life, but also to their overall health, to their cardiovascular system, right? To their respiratory system, to their digestive system, to their joints, to their mental health. That is a huge burden, right? So it's unacceptable as a healthcare person right now to see somebody with that body mass index and not help them with their weight. Now, if we can achieve this result of reducing that weight through non-surgical means, of course, we will. But in reality, we know that it is extremely difficult to significantly come down from that weight without bariatric surgery, right? Now, there are people who may really not like the idea of surgery. In fact, the vast majority of people who suffer from morbid obesity, when they first hear about bariatric surgery, they reject that idea right away because they think it's too radical. They think it's something that doesn't apply for them. They think it's something that shows weakness because they don't have willpower and so forth. And all these are really the result of the prejudices that society has imposed on people who struggle with weight, right? And then after a while, people realize after several attempts, after going year after year after year without really succeeding, and yet seeing their weight even going up and up, then they realize that bariatric surgery is really the ultimate solution. And currently, we don't have anything that is similar to bariatric surgery in terms of its effectiveness, right? So surgery, yes, it's a serious endeavor, but it's tackling also a very serious problem. And that's what we have to make sure our patients understand. To talk about the other issue that you brought about, when patients come to our program, of course, the first thing that we do in our program is try to educate them and introduce them into a healthy lifestyle. That's very important. Many of my patients, the first thing I ask them is if they drink soda, for instance. And many will tell me, yeah, I've been drinking soda for years. Well, that's the first thing I want them to take off completely from their life. It's what I call the low-hanging fruit. This is really totally unhealthy, whether it's regular soda, whether it's diet soda. It is just something that is totally unacceptable when somebody is struggling with weight. And many patients understand that, and that's where they start, right? And then we talk about healthy eating, healthy choices, and the work that Fran and Beth and Amy do in our program is to really introduce the concept of healthy eating. Now, I go beyond that, as I told you, because I do like intermittent fasting, and I try to introduce this idea that eating all the time also has its drawbacks. Its drawbacks meaning that it ages our system, as you correctly said, but more importantly, it really interferes with our ability to get rid of the fat by locking the fat within the fat cells. So learn to say to yourself that your digestive system is open for business from this hour to this hour, and it's closed for business from this hour to this hour. Well, many businesses do that, right? We don't go and demand that a certain business be open at midnight. We don't, right? Because you have times in which you're open and not. We have to treat our digestive system in the same way, right? And that's what intermittent fasting is, basically.
Well, I think when the food is still being used as the vehicle for pleasing and for celebrating, there's this damage in the society. Like, we can talk about my mom, your mom. Like, how do they actually show us their love and affection is giving food. So,
yes, absolutely.
Like,
absolutely.
My mom actually is. I don't know your mom how much she insists, but my mom insists to a point where you have to be rude to her for her to stop.
Oh, my mom is the same. I mean, she would not let you. She would chase you, actually, if you don't finish your plate. But this is cultural. It's ingrained in us. And also, it is true that our parents' generation may have lived or heard of times of deprivation, right? So they think that it is really a blessing that we have so much food right now, and we should enjoy it. But we, as modern, healthcare givers, understand now that food, yes, is necessary, but when it's in excess, it actually hurts us greatly. And that's what we have to understand and try to educate people about it.
Interesting part of this, Dr. Gao, like talking about our families, our parents. My dad actually used to do Monday and Thursday fasting. Okay. And he don't call it intermittent fasting. He did it for his religious beliefs. So, but that's maybe part of the reason. He's almost 81, and he's
in great shape. He's in great shape.
I mean, he's a healthy 81, and like it makes a lot of sense because he has done that for so many years.
Absolutely.
And this actually is proven in so many different ways. But I think one of the other things that we are doing with our program is putting these types of events every week in different formats. So I do want to share that with our audience. So then, this may be our last event for this year, but we are going to keep our Fridays. So we have the UMACO recent events, 2 p.m. I also do now bring one of our clinicians every other week. Today we have our Dr. Carlo Valencia, who did we did discuss the depression, and many of our patients do have depression. Mm-hmm. And this event, 3 p.m., our Bariatric Friday, and then we have Bariatric Support Group. That's the first Tuesday of every month, 6 p.m. And then we have weight loss webinars, second and fourth Tuesday every month, 6 p.m. And finally, we have our Wednesday wellness webinars, and that's the second and fourth Tuesday, 7 p.m. Every month. So these events, the idea behind these events is for our existing patients mainly, so that they can kind of see what's going on, and we can actually support them from the digital world, so that they can actually get that extra support that they need from us. And I think these events are now reaching out to more people, and we are going to keep doing this for next year, and hopefully we can improve more and more what we are doing. We can build more and more what we are doing today. And so that's what we have for today. Dr. Irgau, we have time if you have any closing comments.
Absolutely. So first of all, I want to wish everybody that follows us happy holidays, and I wish them a lot of good times with their loved ones, precious times with their loved ones during these holiday times. But at the same time, I think it's important for us to understand also that although we have pleasure eating, we have to watch, obviously, the fact that gaining too much weight is really damages our health. So using, like we talked in previous sessions, using small plates, avoiding excess alcohol that is just added calories, but also increases our appetite, and then going for healthier foods first, like vegetables, as we choose our meals. Those are simple things that we can do to limit the excess weight that is possible to gain during the holidays.
Well, Dr. Irgau, thank you so much again. So, these events, some of them we are repeating the same topics, but each time we discuss, there are new stuff that we are learning and new people that we are reaching out. And we'll be back next year with the same schedule. Bariatric Friday on every Friday, 3 p.m. So we'll see you soon. Well, Happy New Year.
Thank you. Thanks very much. Bye-bye.